All right, so here's our suffixes, some suffixes, okay? I'm going to try to keep moving. So here it's an excision. Here we have an otomy, which is an incision. So obviously two extremely important words to know the difference between. This is the difference between the right code and the wrong code. An excision, I'm cutting out, right? An incision, I'm cutting into, right? So I've got a boil, they're going to incise it, right? I've got a lump, they're going to excise it, right? And ostomy, which we talked about, creating an opening, like I'm getting a colostomy bag, okay? Yeah, I don't want that either. I always joke, I'm like, reading these manuals makes me feel very fragile as a human being.
Yeah.
There's a lot of stuff that can go wrong with you. It's amazing.
Yes.
All right, so suffixes, that's going to be important as well. There's suffixes that indicate a diagnostic procedure, like graphy. What do you think that would be?
Writing?
No. It's like creating a recording, like a phonograph. Okay. Ryan, you're going to go back and you're going to watch this video and be like, they are just all over the place. Scopy. So scopy, I'm visually examining, right? Scope, got a scope, right? And endoscopy, endo means to go into. They're going into you with the scope, right? Endoscopy. Make sense? Centesis. We've been talking about pregnancy off and on this morning. What's an amniocentesis? What do they do there?
Take amniotic fluid out of your belly, right?
They take amniotic fluid out of your belly, right? How do they do it? With a big old needle, right?
Wrong.
Okay. So, centesis means I'm puncturing to withdraw fluid. So if you run across, you're studying your medical terminology, you're doing your flashcards, you've got this going on, right? But if you run it, you're doing some coding, you're doing an op report, and there's a word you just have never even heard of before. But if you see centesis, maybe I can try to figure that out. Think about a word that you know that contains that word, like phonograph.
Right.
You know what I mean? To kind of, it's just those little clues. In the real world, because there's textbook coding, and then there's real world coding, and those are different things. That's not something to worry about because you learn it on the job. Everybody does. You're like, oh, okay. And some of the rules are a little loosey-goosey, and it's hospital policy or something like that that dictates how you use those codes, or insurance payer policy, or what have you. It's all different everywhere. Everyone always has to learn it. It's okay. There's a learning curve. It's fine. Okay? All right. So, but in the real world, there's zillions of medical terms. There's some archaic terms that some doctors just like to use. I don't know if they want to sound smart or what, but like, what the heck is that? I'm reading a note, and I'm like, what is he even talking about? Google is your friend. Okay, so what I always do, whenever I'm, if I'm at a new job, I would change jobs a lot, but Sarah gave me this my little laptop I get to carry around me because I don't have a desk. I don't even have a desk. I just kind of go wherever there's room for me. But which is why I live out of that bag. But one of the first things I always do is when in my browser, my internet browser, is I have a medical terminology site. I have it pinned right there to my bookmarks bar. Okay? Because you're going to run across stuff or abbreviation. Oh, that's another thing to think about for your flashcards too. Is some abbreviation like MRI, EKG, stuff like that. That's a good thing for your flashcards too. But I mean, it happens, you know, between me and my manager, we have 50 years of medical billing and coding experience, and we'll read something, we're like, what does that mean? Look, it's okay to look it up. Can't look it up during your test, unfortunately. But in the real world, you can look it up, because there's gonna be curveballs that are thrown at you, and it's okay. All right. Moving along. You're gonna have just kind of general ones. We talked about like AAPC, which is basically like viewing. So I used this word earlier. We've all heard that word, biopsy. What are they doing when you get a biopsy?
Removing a piece of the,
Whatever. To look at it, right? Bio means life, biology, right? Okay. Bio, they're just removing tissue to, that's what it means, okay? We all know what that word means. Okay, let's see. Let's talk about a couple prefixes real quick, and then I want to keep moving and get into our coding books here real quick. Let's see, so some common ones, A means without. So if I have anorexia, what's the deal with me? What am I not doing?
not eating.
Probably, right? Okay, so ia means condition, right? Not so is like for eating or consuming or whatever. A means without, so I've got the condition of being without eating.
Okay.
Okay? Aphasia. Aphasia means speech. Ia, condition of, A is without, so I've got a condition where I can't talk. Aphasia. Okay? All right? We know what this means. What does anti mean?
Against?
Yeah, it's against, right? So if I've got an antibiotic, what's it doing?
Killing bugs.
It's killing bugs. Bio means life, right? It's killing bugs. Anti. We talked about this one already. Dys, right? Dysmenorrhea. It's bad or it's painful. Okay? These are going to be important, like directional ones. These are important to know too. Like we talked about one already. We talked about hyper, meaning above, right? I've got hypertension, right? Hypotension, hypo's below. Hypertension, I have high blood pressure. Hypotension, I have low blood pressure, right? Hyperemesis, throwing up a lot, right? You don't really have hypoemesis. I have hypoemesis right now because I'm not throwing up, I guess. We'll see how the day goes. I don't know. All right. Okay, so like epi means above. So if I've got epigastric pain, where's my pain at? It's right here, right? Gastro is stomach, right? That's one that we all know, right? If I've got epigastric pain, it's right here, it's above. Okay, my epidural layer of my skin is the top, okay? Let's see, so sub, what does that mean? What does the submarine do?
Below underwater.
It's below, right, So I've got my epidermal layer of my skin, but I've got subcutaneous tissue under there, right? Okay, epi, sub, okay? So those directional ones are important, or body positions. Once again, going back to my example, if I don't know what it means when the patient's in the supine position, then I could code it wrong, same thing with that. There's measurement prefixes like bi, tri, right? How many wheels does a bicycle have? How many wheels does a tricycle have? Okay, that's pretty easy. How many wheels does a unicycle have?
One.
fun, that's right. Okay. Pre and post, that's pretty self-explanatory. See if we got any other exciting ones here. Okay, so you kind of get the idea there with the prefixes and the suffixes. Then the root words, some of them we know, like gastro. We all know what my gastrointestinal system is. Most of us know what arthro is, right, for your joints. Cardio, we all know what that is, okay? But some of them, it's just going to take, it's just rote memorization. I'm sorry, there's not a better way to tell people to learn terminology, but it really is. And contextualizing it, you know what I mean? So like hepato, liver, okay, those are, I don't talk about my hepato over here. But it doesn't, but remember it's Greek and Latin, so I say liver and hepato is like, how does that connect? Oh, I don't know, but I'm not a linguist. I know a linguist, maybe she could explain. Cephalo for head, okay, myo for muscle. So I've got myalgia, right? I've got muscle pain, right? Myalgia, right? Okay. Some of them are very similar to each other too, so that's just kind of something to be aware of. Some systems can have more than one root word that's attached to it, so it's just going to be in your best interest to just kind of work through all those. But like I said, flashcards are your friend, and having a friend help you go through your flashcards helps too a lot. Yeah, because if you're just reading them yourself, but then when someone puts you on the spot, you're like, oh, I don't know what that is.
I know, you think you know them all.
Right, you do, and then, but it gets easier, I promise. It's just practice, practice, practice. That's why I would recommend as part of every study session, maybe take 15 minutes to go through your flashcards or whatever, okay? Or if you want to split into different things, one night you work on anatomy and terminology, then you work on ICD or whatever works for you. That's the important thing.